Hi everyone, welcome to today's video where we are going to learn about hepatitis. So what is hepatitis? Hepatitis simply means inflammation of the liver. The liver is a very important organ in our body. It helps us digest food, store energy and remove harmful toxins. But when the liver gets swollen or inflamed, it can't do these jobs properly. This condition is called hepatitis. Suppose, think of your liver as your body's filter. When it's inflamed, it's like a clogged water filter. It can't clean properly. According to World Health Organization WHO, over 350 million people worldwide are living with chronic hepatitis B or C. Let's talk about what causes hepatitis. The most common cause is viruses. These include hepatitis A, B, C, D and hepatitis E. Another major cause is alcohol consumption. Drinking heavily for a long time can damage the liver and lead to hepatitis. Certain medications, if overused or taken incorrectly, can also harm the liver. There is also something called autoimmune hepatitis, where the body's own immune system mistakenly attacks the liver. And in some cases, toxins or other infections can also cause hepatitis, but these are less common. Now let's look at the 5 main types of hepatitis: A, B, C, D and hepatitis E. Hepatitis A is usually spread through contaminated food or water. It's common in places with poor hygiene. The good news is it's usually short term and people recover completely. Hepatitis B spreads through blood, sexual contact or from mother to baby at birth. This one can become chronic, meaning it lasts a long time and can damage the liver. Hepatitis C spreads mainly through blood, especially by sharing needles or unsafe blood transfusions. Like B, it often becomes chronic and may go unnoticed for years. Hepatitis D is unique. It only happens if someone already has hepatitis B. It can make the infection worse. Finally, hepatitis E is similar to hepatitis A, spread through dirty water. It's more common in areas with poor sanitation and can be risky during pregnancy. So each type has different ways of spreading and affects people in different ways. Let's talk about the signs and symptoms of hepatitis. Some common symptoms include fever, feeling very tired or weak. This is called fatigue. Loss of appetite, not feeling like eating. Nausea or vomiting, that is feeling sick or throwing up. One of the most noticeable signs is jaundice, where the eyes and skin turn yellow. To know further about jaundice, I'm linking the video at the top right corner where you can check on it and learn more about it. You might also notice dark colored urine and pain or discomfort in the upper right side of the belly. That's where the liver is. But here's the thing. Sometimes, especially in hepatitis B and C, people don't have any symptoms at all until the liver is already damaged. That's why testing and early detection are so important. How do doctors find out if someone has hepatitis? The first step is usually a blood test. This can help detect the virus and see how well the liver is working. Then there are liver function tests, which show if the liver is damaged or inflamed. Sometimes doctors may use ultrasound or special scans to take a look at the liver and check for any swelling or scarring. In rare cases, a doctor might do a liver biopsy. That means taking a tiny sample of the liver tissue to study it more closely. These tests help the doctor understand what type of hepatitis it is and how serious it might be. Let's talk about how hepatitis is treated. For hepatitis A and E, the good news is they usually get better on their own. What you need is rest, plenty of fluids and healthy food. Hepatitis B and C may need antiviral medications to help fight the virus and protect the liver, especially if the infection becomes chronic. If it's autoimmune hepatitis, where the body attacks its own liver, doctors use steroids or immune suppressing drugs to control it. No matter what type, it's very important to avoid alcohol and anything that can damage the liver while you are recovering. And of course, always follow your doctor's advice and go for regular checkups. If hepatitis is not treated or become long lasting, it can lead to serious problems. One of the major issue is chronic hepatitis. That means the infection lasts for more than 6 months. Chronic hepatitis B and C are responsible for nearly 1.1 million deaths per year, mostly from cirrhosis of liver and liver cancer. Over time, this can cause liver scarring and also called cirrhosis. In severe cases, liver can stop working properly. This is called liver failure. And in some people, long-term hepatitis may even lead to liver cancer. That's why early diagnosis and treatment are so important. The good news is hepatitis can often be prevented. Firstly, get vaccinated. There are safe and effective vaccines for hepatitis A and B. Don't share needles, razors, or toothbrushes as they can carry infected blood. Practice safe sex to reduce the risk of hepatitis B and C. Always drink clean water. Eat safe, properly cooked food, especially when traveling. And try to avoid drinking too much alcohol as it can harm your liver over time. The WHO aims to eliminate hepatitis B and C as public health threats by 2030. So remember, hepatitis is liver inflammation caused by viruses, alcohol, or other factors. It can be mild or serious, but with good hygiene, vaccines, and proper treatment, it can be prevented and managed. Thanks for watching. If you learned something new today, please like, share, and subscribe for more health related videos. If you have questions, leave a comment below. Stay healthy and take care of your liver.